Good afternoon, everyone, and a warm welcome to today's live webinar. I am Hetvi Shah, your host for this session. And I'm so thrilled to have you all here today as we dive into a critical topic, which is understanding the surge of dengue, chikungunya, and monkeypox cases in India recently. As India has been experiencing a rise in vector-borne diseases like dengue, chikungunya, and recently mpox as well. So today we'll explore what is actually driving this surge, how we can prevent and manage outbreaks, and the latest advancements in vaccines and public health strategies. And for this, we have a very special guest with us. I'm honored to introduce Dr. Amitav Banerjee, a distinguished epidemiologist with over 3 decades of experience in public health and disease control. He's not only a renowned researcher, but also one of the esteemed scientists who earned a spot in Stanford University's 2024 list of the top 2 global researchers. So, Dr. Banerjee has dedicated his career to studying emerging infections and shaping public health policies to combat them effectively. So, Dr. Banerjee, thank you so much, and it is a true privilege to have you with us.
Thank you, Hetvi, and it's a pleasure to come on MedSynapse platform.
Thank you so much, Doctor. So now let's just begin right in. So, if you can talk about the seasonal nature of these diseases, so can you walk us through the seasonal patterns of dengue and chikungunya outbreaks across different regions of India, and what environmental and societal factors contribute to these outbreaks?
Yeah, this is an important question. Dengue has been with us for decades. The first major outbreak of dengue was in the 1960s in West Bengal, and both coexisted together, dengue as well as chikungunya. And both have similar symptoms, joint pains, and chikungunya, the joint pains persist for long. And in recent decades, I would say, since the past 3 decades, we are having a real surge of dengue and chikungunya and all these vector-borne viruses, arboviral disease as we call it. This is associated with large number of, as you said, environmental factors, ecological factors, demographic factors. There's an increase in population, then population movements for job, for labor, then big projects. You see, both and the climatic conditions in particularly in two cities of India, which favors the breeding of vectors and increases their survival. The Aedes, the Aedes vector, Aedes mosquito is known as the tiger mosquito because it is not only looks like a tiger because it has got the black and white strips on its legs and body. So it looks like a tiger and it survives like a tiger also because it can withstand any adverse environmental conditions. Even comparatively dry conditions, it goes, the eggs go into sort of a estivation, and once a little water is enough for these eggs to again reactivate, and they are the actual reservoirs of these viruses, the Aedes, chikungunya, and even Zika also, because Zika is also part of the same dynamics. These three viruses go together. And of course, earlier days, I remember people used to get sick, joint pains, and the diagnosis was not there. Another reason that we are diagnosing this more effectively. And dengue, definitely, dengue, one has to be very careful. Particularly in children, it can be very severe. And we get large number of cases. You see, in Asia, 70% of the cases are from India, dengue cases. It's a big bulk, and children, they suffer more, causes high mortality in them, particularly below 5 years. And other people also, it can have takes various forms. 50% may be asymptomatic or perhaps more. They may be just asymptomatic, but they will be carrying the virus. Then another 40% will have some symptoms. Some will have some fever, some joint pain. A few people go into very severe forms of dengue. There are two severe forms of dengue. That is the dengue, hemorrhagic fever, they are bleeding, uh, and dengue shock syndrome. Suddenly, a fall in BP, there is a fluid collection in compartments in the body, and the person may go into hypovolemic shock, and the fatality can be up to 5 to 10%. So they require very good management actually. That is another problem. Many people may not be getting it, and it causes dengue can cause deaths due to these complications. And another problem with dengue is that it has got four strains of the virus. All four strains keep circulating together, one after the other, or some there are different strains. And recently, a fifth strain has been recently, almost 5 years back, a fifth strain has been identified in Malaysia. And another problem with dengue is that the infection with one strain does not give you protection with the other strain. So, in fact, it can complicate matters. In fact, if you get mixed infections, there are more chances of reactions and dengue hemorrhagic fever. So that is a dengue is a difficult disease to tackle that way, and another that this same poses the challenge for the dengue vaccine, which has not been very successful. In fact, it is contraindicated in young children below 5 years, and the main brunt is borne by children. So it's a situation is like that, and they have got it's not very vaccine which can be rolled out without supervision. So the vaccine is take difficult as present. And the other causes for rise is, as you said, as I said, the projects, different projects, like we are having metros and places. So metros mean it is not only the small water collections and post rains, like climatic conditions, after rains particularly, or poor engineering, public health engineering. We have potholes, we have improper drainage, we have got small water collections in different places, we have got poor waste disposal. We just throw away the tires, the plastics, and as I said, the Aedes mosquito, the tiger mosquito, it can breed just even in a ashtray if a little water is there. And of course, the poor water supply. Many people in urban slums and chaos, they have to store water because the water supply is not continuous. So this and the people do the gardening in the balconies. So these are the two types of Aedes vector. One is Aedes aegypti, which is the main vector, which is a peridomestic, just around the houses, and they can bite fiercely. And another problem with the Aedes mosquito is that they bite during the daytime. So you can't, I mean, night biters, you can use a mosquito net. So if they are day biters, children are exposed when they go to school. They are exposed. They school also, most of the water collections are there all over the place. And then so these are some of the challenges. And then another problem is people are coming from all parts of the country, the laborers. They stay in temporary settlements, which are overcrowded, which will have a lot of mosquito breeding, water and all. They will wash their faces and all around their settlements. The water collections are there, and the vector can breed easily. Another problem with the dengue Aedes vector is that once they are infected, they are infected for life. The virus is infected for life. I mean, the mosquito carries the virus for life, Aedes mosquito, and they pass it on to the next generation also through the ovary. That is called trans-ovarian transmission of the virus. So you see, ये पूरा dynasty system हो जाता है transmission का. It's not only in politics there is dynasty. In the tiger mosquitoes also, the young tigers are already infected without biting the human. So they are the major reservoir. Another problem is this. They are very restless biters. Like other malaria mosquitoes, it will bite one person in the house and it will take its full meal for its ovulation. But the dengue, this Aedes mosquito, it will bite little blood from one person, then it will go to the next person, and it goes like you are going for a buffet or something like that, buffet. Okay, so it will taste a different blood from different people. So simultaneously, all the household may get sick. Otherwise, it should not pass from person. So these are some of the challenges. So you are against a very heavy odds. So the only way to do it is involvement of the people, involvement of the community, Actually, then we have got multi-storied buildings, so there are different blind spots where water collects just after the rains. So it's almost becomes, and this all this fogging and all doesn't work because space is so much that mosquitoes are just inside the houses, breeding just outside the houses. Even inside the houses, there are water collections. So these are some of the challenges.
Yeah,